Okay, our next speaker is Dr. Phillip Lujan with NMSU Extension Plant Sciences Department. He is the NMSU Extension plant pathologist. He received his BS and MS in agricultural biology with a minor in molecular biology and a PhD in plant and environmental sciences with an emphasis in plant pathology at New Mexico State University. For 5 years before his current role, he was the plant diagnostician in the NMSU lab, and that's where I first met Phillip. Is before he was in charge of it, he was the one doing all the work. Probably still is the one doing all the work. And so he now provides statewide extension programming with a focus on plant health and the use of integrated pest management strategies. Other responsibilities include conducting applied research projects and providing administrative oversight to the NMSU Seed Certification Program. So, Dr. Phillip Lujan.
Thank you so much. Hey, thank you. I'll put that there. All right, well, thank you. Thank you for that introduction. I'll be talking present and upcoming tree diseases on the horizon in New Mexico. And so I usually like to provide a talk outline for these. We're going to do a plant pathology refresher or plant pathology 101, get everybody sort of on the same playing field with a few definitions and, go over some management strategies. Then we'll talk about the New Mexico State University Plant Diagnostic Clinic. Who's heard about that? Raise your hands. A fair number, that's good. For those that haven't, well, we'll sort of talk about it a little bit more. And we do have a new staff member on there, so I'll introduce her later on. And then we'll talk about commonly present tree diseases, so maybe top 5 that we generally see all the time. And then some diseases to look out for on the horizon. So, with climate change, with climate stresses like that, things that we're starting to see a little bit more in the lab because of these plant stresses. All right, so general tree problems. There are many different living, which is what we term biotic, and non-living abiotic stressors that can have a negative impact on trees. Does that look like it can have a pretty negative impact on your trees? What about that too? Yeah, that can have a really devastating impact on your trees. The more stressed a tree is, the more susceptible it is to disease. So same thing like us, right? If we don't exercise well, if we don't eat right, we don't take our vitamins, we can be a little bit more susceptible to some of these common colds, common viruses that that are around in the air. Versus one, we're taking care of our bodies, we're exercising well, we're getting good nutrition. Same thing for plants, same thing for trees. You provide them adequate irrigation, fertilizer when necessary. The nutrients are important. As stress-free as possible. This is gonna kind of be the theme of my talk, is keep your plants as stress-free as possible and make it less susceptible to disease. And then finally, successful disease management. It depends on that accurate identification of the causal agent. That's extremely important, right? Because we need to know exactly what we're dealing with, if it is in fact an actual disease, or is it simply just maybe an environmental issue, or something, or something like this that's causing a problem. We're not gonna just grab our pesticides and start spraying, right? That doesn't make sense. We need to really accurately identify the causal agent. And then once we do that, then we can, we have a whole range of things in our IPM toolbox and integrated use of all control methods. And so we'll describe that a little bit later. All right, so next, definitions. Plant disorder and a plant disease. A plant disorder is a condition that interferes with a plant's normal growth and development. That can be, like this here, iron chlorosis, a nutrient problem, an abiotic issue. Or even it can be a cercospora leaf spot, because both it interferes with that normal growing, that normal growth and development. But for a plant disease, it's a little bit more strict, I guess. Any abnormal growth or development in a plant, and this one is specifically caused by a pathogen. So when we're saying plant disease, that's specifically caused by one of these fungi, bacteria, viruses, phytoplasmas, things like that. While a plant disorder can be both a nutrient, an abiotic, or a biotic issue. All right, talking a little bit more about causal agents, some biotic factors or living things, as I mentioned before, fungi, bacteria, viruses, nematodes, parasitic worms in the plant, in the soil. It can also be some type of aerial or foliar nematodes as well. Parasitic plants, have you guys seen in your cottonwoods, right? That's a big issue, is the mistletoe. Causing a lot of issues, and so here is one in Las Cruces that's filled with mistletoe. Insects can be not only because they cause physical damage to the plant or trees that cause stress, but they can also vector a lot of these viruses. They feed on it, the virus gets in their guts, they start moving from tree to tree and start spreading the virus that way. So sort of a twofold thing. And weeds, same thing. They can compete for resources, stressing out your trees, but they can also harbor a lot of these virus diseases. We've seen them harbor like verticillium, which is a fungi. Some of these weeds can do that, and so they can harbor those, and they can also provide sort of an avenue for insects to overwinter. So they move from the tree or plants, they move to those weeds over the winter, and then move back to those host, either annuals or trees when they have foliage. Diseases, they can spread from plant to plant or from tree to tree, and they're patches or in a smaller area. So you're not going to have a whole row of, a whole orchard that's just completely dead with something. It's going to be a little patches here and there. Where abiotic factors or non-living things, temperature extremes, right? Too hot or too cold, that can cause a lot of stress on your trees. Moisture extremes, we're in the desert here, arid environment. We don't get a lot of moisture, and so that can be an issue as well. Or even, the opposite, where we get our monsoons. Too much water at one point can cause a lot of stress on your trees as well. Soil problems, we don't have the greatest soil. I think we all know that. We have very calcareous soils. It can cause a lot of issues, binding up nutrients and available iron specifically for that. And that leads right into the nutrient deficiency or toxicities. And then wind. Wind is a big issue. This is very sensitive. Wind, it can knock our trees down, right? Some of the branches falling off if it's, or even young trees, if they're not planted well, they can just fall over. Pesticide toxicity, that's always a big one, right? Somebody doesn't accurately identify something, or a misapplication as well. They can cause a lot of problems. And improper cultural practices. This is sort of a catch-all. This is maybe not planting a tree properly, either deep enough or too shallow. They didn't, circling of the roots. They didn't properly address the roots prior to planting. Or even your growing zones. That's very important, and I'll be talking about that later as well. If you're planting a tree in the wrong growing zone, it's always going to be stressed, and so that's going to be an issue for your tree, and so they'll be more susceptible to diseases occurring that way. All right, so when something comes into the lab, typically I try to determine whether it's an environmental thing or an abiotic or a pathogen. And so here are some sort of generalizations. Typically more than one plant species is affected. And so you get a tree, you'll get a different plant, different types of trees, the grass, and they all just look very terrible. And so maybe there was an irrigation problem, or there was some sort of weather event that occurred that caused a lot of issues. Symptoms often develop suddenly, so from one day to the next, you'll see either a tree up and die, or have a lot of issues going on with it. Typically, that's more of an environmental thing, because with pathogens, they really want to develop very slowly. They want to grow within the tree. They want to get all the nutrients it can, grow, then it reproduces, and then it moves off and destroys that tree. So it would be a very bad pathogen if it immediately just killed a tree, because then it would have to find another host right away. And so symptoms are usually very slowly, months, years, sometimes even decades. Symptoms do not spread for the environment, and for a pathogen, symptoms can spread from tree to tree. And then again, the distribution is typically uniform for an environment, and the pathogen is more patchy and sporadic. All right, plant pathologists love to talk about the plant disease triangle. Not everything is just full of disease, right? You need to have 3 specific things all working together in order to have a disease. The first one, you need to have an actual pathogen present, either in the soil, in the air. We can grab a handful of soil, put it in culture, and we can always find some sort of pathogen going on. So typically it's there. That's why you need to have your trees and your plants as stress-free as possible, because it can naturally defend some of those soil-borne diseases that are commonly there. Host, susceptible, you need to have a susceptible host, a specific species or cultivar that pathogen likes. Because not all pathogens just universally attack things, they're very species specific. And so maybe if you know you have this type of fungus always in your soil, then maybe plant something that's tolerant of that fungus. Abiotic-induced stress. This is a big deal now because of our climate stresses. We're seeing a lot of these trees that were okay, but now they're really stressed out because of our crazy weather, our lack of moisture. They're very stressed, and so they're more susceptible to some of these pathogens that are present. And then again, that favorable environment. And so we see in the clinic a lot of samples start coming in after a good rainfall, good humidity, even a microclimate where you're planting your trees too densely, or you have a lot of ground cover that's holding that moisture, a lot of humidity going. That can provide that favorable environment for some of these pathogens to sort of grow, replicate, and infect. All right, so minimize additional stress. Select the right tree for the right growing zone and area. So again, pay attention to your growing zones. A lot of times we see just trees planted in the wrong place, and so they're constantly stressed, and so they're more susceptible to these diseases. It's like, why is an aspen planted down here in the south? That doesn't make any sense. It's always stressed. So before you start planting, check out your growing zones, and then NMSU has a lot of good reference extension material for selecting ornamental trees, tree pruning techniques, IPM for common insect pests, and so here's a sort of a good reference for that. So now we're going to go into some of these sort of horrific pictures of abiotic-induced stress. These are all examples from my predecessor or from me just going around and taking some pictures of craziness that I see, I guess. So let's go back here. Yeah, that'll probably stress out your tree, right? So that's what it looks like on the side there. I think we were in Rhode Island one time and we saw this as well, just planted in these barrels here. Not looking very happy, right? That's probably not the best place for it. Other abiotic-induced stress examples. So we have a lot of rock here, sort of a lot of heat that's going on. This tree is not very happy. And we see a lot now, in our residential areas where you're planting trees that are just, you get this heat here coming from this wall, from the rock, from the sidewalk, from the street. And so these trees are extremely stressful, or they're very stressed out, and you don't really get a lot of good irrigation. And so this was in Las Cruces in the summer, some ash trees that were just, pretty much dead because they were planted in the wrong area. Other examples. They're literally choking this poor prunus. So just pay attention to where you're planting. Even this tree here, it's having a rough time because of the sidewalk here, and then just that girdling right there. So other issues here too, right? They forgot to remove this, and then they're planting a pine right against the cinder block wall here with rocks. It's always going to be stressed because of that heat that's irradiating off there. And so these are all just examples that I see. People must think that I'm crazy. I just go around looking for different things, start taking pictures of trees that are definitely stressed. They have a lot of symptoms going on with them. You feel bad for these types of trees because they're just planted improperly. And so probably in the next 2-3 years, they're going to have to remove them, right, and start again. And hopefully they don't continue to plant the same thing there. So just some examples of abiotic-induced stress. So moving on to symptoms. Symptoms are the responses of a plant to an attack by a pathogen or to stressful conditions caused by one of these abiotic factors, as I mentioned. So examples of that can be wilting, you can get yellowing or chlorosis, leaf spots, witch's broom. I highlighted this one because we'll talk about this in the next slide. Dead or rotting parts, or stunting of plants. And so we can't really identify the problems just by looking at the symptoms, right? Here's an example here, witch's broom symptom. If I get a picture of a sample that looks like any of these here, we can't really tell you what exactly is going on. We can tell you that there is some sort of problem, but we can't really, nail it down to see what the actual problem is. And so here are some examples. This is just cultural practice. So not enough water, it just didn't leaf out well. And so we ran all the tests on all of these things to see what it was. And so cultural practices didn't leaf out well. The next one, mites. The next one, herbicide damage. And the next one was an actual phytoplasma that causes witch's broom. And so these are just examples showing witch's broom is sort of a general symptom to describe this type of tough growth. But it can be caused by, cultural practices, mites, herbicides, phytoplasmas. And so, again, just getting a picture of a witch's broom or a plant or a tree that has leaf spots we can't really pinpoint what is actually the problem. Now, definition for signs. Signs are the visual presence of the pathogen on the plant. So examples of that can be rust, as you see in this first picture here. Pycnidia, fruiting bodies, which are here. So there's a lot of spores in these things. Once the tree's about dead, these are the reproductive structures, and they want to move out. So if you see this, that means it's pretty much gone and too late to do anything. Galls can be another, and then powdery mildew can be signs. So these, if we do get pictures of these are the presence of those actual pathogens, and so we can more or less tell you what is going on and what is affecting your trees. So now moving on to disease management. Again, as I've said before, the key to disease management is prevention. It's easier said than done, but really through management and good planning. So well-managed trees equals healthy trees. The most effective management problems incorporate all 4 of these strategies known to reduce disease severity. And so that's an integrated disease management approach. It's through physical practices such as pruning, cultural practices such as irrigation and planting the right type of tree, biologicals, so using some microbes to help stimulate growth, or roots, or mycorrhizae, and then chemical, that's always part of the IPM, or integrated disease management toolbox as well. So we'll describe each of these in a little bit more detail here. The physical mechanical management is controlling pathogens with physical methods or mechanical devices. So pruning, soil solarization, getting if you have a problem area in your soil, nothing can grow there. Maybe cover it in a plastic, clear plastic. Let that soil bake to maybe get rid of a lot of those pathogens. You're also going to get rid of a lot of the good guys, but you can, once you're done with that, after 2 weeks, you can remove that plastic, go in with biologicals as well, let those get established, and then you can start planting after that. And then other examples, traps and barriers for insect vectors, mulches for weed vectors, and then cultivating or hand removal as well. Cultural management, so the goal here is to select a proper growing environment or work to make the environment less suitable for those pathogens to survive and thrive. So some examples, species and cultivar selection. Again, if you know you have a problem, if you identified it, maybe choose something that's a little tolerant or resistant to that problem. Proper site selection and planting time. So I have this again, probably not the best site selection there. Proper watering and fertilizer, insect and weed management as well. Biological management, that's management of pathogens by other beneficial microorganisms. And so there are 4 ways those beneficials act on pathogens. First is parasitism, so they attack the pathogen directly. The other is antibiosis. They produce chemicals that can sort of kill the pathogens. Induced host resistance, so they help the plant fight off. They stimulate their defense mechanisms, and so they help the host fight off some of these pathogens. And then they can also just directly compete for resources. A lot of these, like trichodermas, they grow very quickly, and so they can outcompete some of these plant pathogens. And then finally, chemical management used to prevent or protect plant hosts from pathogens using pesticides. This is only used when needed and in combination with those previous other 3 strategies that I mentioned. So again, fungicides, bactericides, nematicides, all chemicals. Read and follow the label. The label is the law. And then for fungicides, pay attention and rotate your frac groups. And so the frac groups are there at the top. They have different numbers. The more you rotate those numbers, the better for preventing resistance. And so here's those frac classifications of fungicides. There's a whole bunch, but you can rotate those families around. All right, so most importantly, again, accurate identification of the pathogen or disorder is essential for successful management. Our lab's motto is test, don't guess. So don't just look at something and start and think, well, maybe that looks like leaf spot. Let's get a fungicide and attack that. The plant clinic is here for you. Our director is right here in front of me. She'll be talking next, Dr. Leslie Beck. She's the weed specialist. We have hired a new plant diagnostician, Dr. Srijana Dura. She's, I think, somewhere in the back. I'm the pathologist, and we have entomologist Dr. King and Dr. Pierce. Dr. Thompson, who's sort of running the show here with the other Think Tree board members. She's our horticulturist. And then Jackie Beecham, she's our nematologist. So we have a team integrated. We provide integrated services such as disease problems. We can identify insect issues, plant and weed identification as well. All right, so moving on, bearer of bad news. Plant diseases are very difficult to cure, right? Once we see either a sign or a symptom that's going on, a lot of these systemic pathogens, they go from the roots all the way up the vascular system. And so whenever we start to see something like this, it's already way too late. And so it's very difficult to know, that a tree is infected with something until it's almost too late. So management strategies for plant diseases are usually aimed at reducing the stress of the tree, prolonging life of the tree, not necessarily preventing death. And so it's extremely important we focus our efforts on prevention and stress management. And so that's why I keep on sort of harping at this healthy trees, stress-free environment. So the top 10 trees submitted to the plant clinic, you get these. And then the top 10 tree diseases. And so we'll talk about maybe these first 5 here because we see this year after year as a problem. And then we'll talk about, things that are starting to creep up into the plant clinic that we're seeing a lot more of, year after year. All right, so the first one is Phomopsis blight and canker. So what is that? That's a pathogen, fungal pathogen called Phomopsis. Its hosts are cottonwood, juniper, and pine. There's other hosts, but those are the 3 that we see most often here in New Mexico. And so those spores are spread by wind, rain, insects, natural wounds, any way really that those spores can get in, and pruning. So you have an active wound site, they can get in that way as well. Moisture is required for spore release, and so we see this often, again, as I mentioned, after a good rainfall, or if someone's going and spraying their trees for some reason. I always tell the story that my neighbor likes to spray his evergreens, kind of the needles with, I think that's how he thinks the needles are getting water, but that's one way to easily spread disease, especially if those spores are active on those needles. And so the optimum temperature for infection is about 75 degrees. Disease development, about 90 degrees. It's a serious problem in nurseries because this pathogen can spread very easily through pruning or wounds. And then the landscape trees are rarely killed, but they have like this unaesthetic, look to them. They become sort of like flagging at the end, and so you don't really like to see that as well. Symptoms of Phomopsis blight, you get dieback and blight, as the name mentions. The cankers develop on the larger stems. The small stems are girdled and killed, so like right there, it becomes very girdled, and so no water or nutrients are going up here, and so that's how you get all of this flagging there. And then the signs, there are little black fruiting bodies you can sort of see with sometimes your naked eye, but with microscope, you can see these little black dots and these little strands here that have a lot of spores in them. Phomopsis canker of cottonwood, that's sort of a big one as well. The disease invades only through natural openings and wounds. Initial problems, they sort of tend to look like freeze injury, drought, or a mechanical injury. So it looks like this, but then a little later it becomes a problem. So initially it looks like maybe some freeze damage or a mechanical injury, but in actuality it is Phomopsis canker. And it can result in loss of large limbs or even in tree death, depending on where that canker develops. So how do we, integrated disease management? If this is a weak pathogen, so really prevention is where you start. You want to avoid unnecessary injuries. And so what we mean by weak pathogen is, a lot of these other aggressive pathogens, they can infect a healthy tree, or something that they don't even need to have an injury, and these aggressive pathogens will cut through the cambium layer and start affecting the trees. This one's a weak one, so it needs help to get inside your tree, and so those injuries, those physical injuries are a good place for that pathogen to enter. Reduce stress, proper water and fertilizer if needed. Avoid wetting that foliage, again, because of those spores. They're on the needles. If you start spraying them, they can start spraying everywhere. Prune out infected twigs and branches. Clean your tools with alcohol, bleach, or a household cleaner. It's one way you can spread these diseases is use a tool that's infected, and then you start moving along and start pruning other things, and you can spread it that way as well. The next one is Rhizosphere needlecast. Several fungal pathogens cause evergreen needle diseases. They can infect the foliage, the buds, and the shoots. The major host here in New Mexico is spruce, especially blue spruce, as well as pines. The fungi sporulates in late winter and in early spring, so probably around now is a good time. The spores are spread by wind and rain. And then the symptoms do not really develop until late summer or fall, when they start turning an off color and yellow, and then eventually become necrotic or like dried out and brown, and then they will fall off. So again, that needle discoloration, it goes from yellow to sort of this reddish purple on the needles here, and then they become brown. It can be confused with winter injury and or drought stress. So again, the plant clinic is here to help you sort of determine whether it is an actual disease, whether it's Rhizosphere or not. This disease, typically, it starts from the bottom, and it works its way up, and from the inside near the trunk and out. So if you start to see it look pretty thin at the bottom and towards the inner part here, then maybe it's a needle cast versus a winter injury. And if you look closely enough, sometimes in the spring, you'll see these little black fruiting bodies on those needles, and so that's one way you can tell if you do have Rhizosphere needle cast. Again, for management here, provide adequate water, avoid wetting the needles, promote good air circulation. And so this is probably an area where you probably, this really is right at the base here. You probably want to prune some of that out to get that good air circulation going, that adequate environment. You can sort of open that up. If caught early enough, fungicide treatment can be very effective, either like a Bordeaux mixture or using chlorothalonil as well. And you want to apply that when there's new growth, when new growth is half developed, and then again at full length. Another one here that we're seeing a lot more of, sort of why I highlighted, is Cytospora canker. This is another fungi. Hosts here, apple, ash, cottonwood, spruce, willow, aspen. The fungi attacks trees or tree parts that are injured or in a stress or a weak condition, particularly damaged roots. And so this is one that I like to highlight, that this is an emerging issue due to climate change and climate stresses that are put on our trees. We're seeing this one a lot more come through the lab. So symptoms, they sort of vary based on their host that they're infecting. Sort of general ones are branch dieback, canker, so any canker that develops like here, anything above that, you're going to start to cause a lot of problems because you're not getting the adequate water and nutrients to move up to the tree. Inner bark, sometimes if you scratch off that little cambium layer there, you can see this is healthy tissue, and here's where the pathogen is, and you can start to see a little bit here moving into that healthier tissue. Signs, orange and red tendrils, as I mentioned here and here. Ooze can happen, liquid ooze on aspen, gummy ooze on peach and cherry. And so integrated disease management for this, purchase healthy nursery stock. You always want to inspect your new material when they're coming in. Disease occurs usually on weakened hosts, so the primary method here of management is to prevent stress through proper irrigation, cultural practices. You want to avoid physical wounds caused by any lawnmowers or weed trimmers that sort of cause damage on the crown or on the roots. That's where that pathogen can enter and start infecting. There's not really any available fungicide treatments for this, so again, prevention is key for this disease. Fire blight is next. This is caused by the bacteria Erwinia amblivora. Trees in the Rosaceae family, all of those can be infected by this, like apples, peaches, plums, quince, crab apples, ornamental pears. It overwinters in previous year's cankers and healthy buds. And so in these boxes here, you can see the cankers that are right there, and that's where the actual bacteria is present. And so the optimum conditions is about 75 to 80 for this bacteria, and greater than 55 at night, plus some intermittent rain and moisture and humidity. It's spread by contaminated pruning tools. So if we're pruning our trees and we don't see these cankers, that bacteria can stay on your tools, and you start moving it around and start spreading the disease that way. Some of the symptoms, the infected twigs become water-soaked, dark and sunken, which are those cankers. The young twigs and the branches, they typically die from the terminal end, and they appear burnt and bent. Like this here. This is what we call a shepherd's crook. And so anytime you see that it looks, bent like a shepherd's crook, and you see like somebody put a flame to it, usually we can tell right away that that's fire blight. Start with disease-free planting material for this. Again, prune out infected branches. So if you do look closely and you find a canker, prune at least 6 inches below that margin or that canker and remove that so you can stop it from spreading. Again, clean your tools afterwards using alcohol, bleach, or household cleaners. And then there are protective sprays during flowering, copper fungicides or antibiotics. Usually it's only cost effective for those more commercial operations though. All right, so now just a couple diseases to look out for on the horizon. The first one we're seeing a lot more of is Phyllisticta leaf spot. It's caused by the fungus Phyllisticta. Hosts of this are maple and sycamore. We see that a lot, but it can also infect cherry, mulberry, and oak. Some of the symptoms here, as the leaf spot would indicate, small circular or oval spots on the leaves. The spots can be gray, brown, black in color. You can get those dark red with purplish borders. They can coalesce if many are present, so they can all get together and start and become a bigger issue. Severely infected trees, they become yellow and they drop off. And then the signs, if you can see these little black pepper-like fruiting bodies, we can tell that that's Phyllisticta. Cultural practices are a big one with most of these that I'm going to be talking about. So you're going to rake up and remove a lot of those fallen leaves. we usually get the question, can we compost these leaves? And so I'd be very careful. We like to use leaves with our compost, but make sure to use healthy leaves. So if your tree is infected with this or any other disease, I'd be very sort of wary to use those in our compost, just to avoid a lot of these pathogens. And so I would not use these leaves that are affected with any of these diseases in your compost. Avoid overhead irrigation with sprinklers. You can start spreading the disease that way. Remove weak or dead branches. Fungicides are available, such as chlorothalonil, but really, if you follow these cultural practices, remove those leaves, typically it's not really needed. The next one is anthracnose. This is a sort of a group of fungi called Colototricum, Discula. I'm not even going to say the other one. But that's a group of fungi that, it's general is anthracnose. That's the disease. And so hosts of this are ash, elm, maple, oak, and again, sycamore. And we see anthracnose and sycamore. It's pretty common. Symptoms on the younger leaves, tan to brown, irregular shaped spots. So it looks like some of these here. The infected leaves often look pretty distorted, but they can also be cupped or curled, and so that's sort of this. Severe infections, they can result in spring leaf drop. And then in older leaves, you get these tan to dark brown spots like this and this. The leaves don't really become cupped or distorted on the older leaves. And then leaf symptoms are most severe on the lower and inner branches of the tree, but they can also progress up through the canopy. So the life cycle for this disease, the fungi overwinter in infected twigs or in dead leaf litter. And so that's why we want to get rid of that leaf litter there, because the pathogen will just be sitting there happy on the ground until new foliage comes in the spring, and they can infect that new foliage. Typically, anthracnose does not really cause permanent damage to established trees, so it's more like of a cosmetic problem. Cultural practices are keep trees healthy, reduce stress, of course, avoid sprinklers that splash water on tree leaves, rake up and remove leaves as well, and then prune out infected twigs. Fungicides are available, but again, cultural practices typically manage this disease pretty well. Next one is verticillium wilt, verticillium dahliae or verticillium alboatrum. Those are just different species, but verticillium is the genus. The hosts are catalpa, elderberry, juniper, mulberry. We even see it in our privets, maple and ash. The life cycle persists as microsclerotia in soil. So microsclerotia are very small overwintering structures. So the fungus binds itself up like a ball of yarn, very small, drops in the soil, can survive in the soil for 20 plus years until you get that susceptible host. So, you're doing well year after year. Maybe one year you're out of town or something. You don't necessarily take care of your tree as well. That pathogen has been sitting there for 15 years. It finally realizes, hey, this tree is, a little bit more stressed out now, and so I can infect that tree. And so it does. So that's what that microsclerotia can do. It infects the roots, a susceptible host, and then it travels up the vascular system. And so when it does that, you can see that here, going up the vascular system in branches. When it does that, it inhibits water and nutrient transport. And so wherever that pathogen is in that branch, you can see the leaves sort of just start to dry out and die off. So the symptoms, the foliage from the individual branches, they can suddenly wilt and die. It can be scattered or just on even just one side of the tree. It all depends where that pathogen is moved up through that vascular system. The foliage loses color, green to brown, and falls off, and then you can, if you peel it back with a lot of this verticillium, if you take a branch, you pull back the cambium layer here, you can see that dark area where that pathogen is, and so that's where we're pretty confident that that's verticillium. Integrated disease management. Provide a good growing environment with appropriate irrigation. Applying small amounts of slow release fertilizer to promote new growth. Sometimes it can increase the time of survival. Prune off dead wood. Soil solarization in the summer. Again, this is probably after you've lost a tree or two and you've figured out what's going on in that area. But soil solarization can help after that. Or plant-resistant trees in trouble locations. And so apple, oak, honey locust, sycamore, or conifers are not hosts for this disease. And so you can use that, that information, I guess. Because once a tree does get verticillium wilt, again, it's very difficult to manage it. And so it really depends on where it goes in the tree. If it's a branch or if it goes up, that central leader and it just kills the tree. Sort of a guessing game, a fun little game that the fungus likes to play with us, I guess. And then finally, Marsanina leaf spot. Other names it goes by are aspen leaf spot or apple leaf blotch. The pathogen is caused by the fungus Marsanina. And so we're seeing a lot of this in aspens and cottonwood. So if you've seen this type of patterns here and here, and in your cottonwood that looks like that, maybe it's Marsanina leaf spot. We're seeing that more and more often. Again, the symptoms, leaf spots, initially they're bronze to brown with yellow edges, and then they turn black. Premature leaf drop can happen, and then the leaf petioles can also develop lesions. And so signs, if you do see it, a cervili, which are the fruiting bodies, you can see that dark, all those dark little strings there, they develop within those infection sites. So again, with leaf spots, the leaves first infected in early, or I guess the life cycle is the leaves are first infected in early spring. The spores then spread by wind or rain and infect early foliage. Then they produce those fruiting bodies and then spread by water to new infection sites. And so that cycle can be repeated 3 to 4 years, and it can eventually, if bad enough, can cause tree death. So again, as I mentioned, with leaf spots, cultural practices such as raking up those fallen leaves, prevent splash from sprinklers, avoid close planting to get that, that environment, conducive environment, get that moisture out of there and the air circulation going. And then fungicides are available for bud break to protect new growth, such as chlorothalonil or propiconazole. All right, so just remember the plant disease triangle, not everything is infected. You can use your knowledge of the plant disease triangle. Typically, we can't really do much about the pathogens that are present, but we can certainly think about hosts and resistant hosts or tolerant hosts based on species or cultivar. And then you can also address that favorable environment, right? So either pruning, removing a lot of leaves that are on the ground, holding that moisture, a lot of that ground cover, just sort of figuring out that favorable environment and making it less conducive for that pathogen to survive. And so the keys to disease management, again, prevention through management and planning. Well-managed trees equals healthy trees. the integrated disease management options, physical, cultural, biological, and chemical. All right, I guess that is about it. If you have any questions, here's my contact information. I'm really good with emailing. Sometimes calling the office is difficult because we are all over the state. And so email is always the preferred method. Website to look at, sample forms, some relevant information, publications, all of that is right there. And then I think we have this.